Hello and good evening, everyone. So, welcome to another live session on Idento. Now, today's live session, as you can see, it is exclusively for our dental PSC aspirants, both the Madhya Pradesh PSC aspirants and also the Kerala PSC aspirants. Okay, so today we'll be discussing some of the very important questions from dental anatomy and dental histology that were asked in the previous year dental PSC question papers. Okay, so as you know, dental anatomy and dental histology is a basic and easy subject. So if you are like really careful while answering the questions, then you can really score good marks. Okay, even full marks from dental anatomy and dental histology. Okay. So if you look at the previous year question papers, you can expect an average of 6 to 7 questions from dental anatomy and dental histology together. Out of these, 6 to 7 questions, most of them are like factual questions, like the ones that test your memory. Okay, the direct, straightforward, one-liner questions were asked most frequently. Okay, that those were the pattern that was seen in the PSC question papers. Okay, and out of these questions, out of these 7 questions, if like there are like 6 questions asked from DADH, then for Madhya Pradesh PSC dental exams, uh, if there are like probably if like imagine if there are 6 questions asked from DADH, then for the MPPSC, for the Madhya Pradesh PSC, it will be usually like 3 questions from dental anatomy and questions from oral histology. Okay, such an equal weightage is seen in the previous year papers. Whereas for the Kerala PSC, if like 6 questions were asked from DADH, then around 4 to 5 questions will be from oral histology. And like maybe 1 or 2 questions will be from dental anatomy. Okay, so more weightage is given to oral histology in case of Kerala PSC exams. Okay, you have to remember that because you should know which areas you should focus on while studying. Okay, so this is the pattern of question or the pattern that is seen in the previous year question papers. Okay, now coming to the topics that you should focus on. Okay, so regarding the oral histology, starting from development of teeth, you should have an idea about the cell rust. Okay, both the cell rust of Serrae and cell rust of molasses, they are the remnants of what and where they are seen. You should definitely have an idea about that because frequently questions were asked regarding that. Then the transient structures in the cap stage, the genes. Okay, genetics in tooth development is a very vast and complex topic, but you should at least know the gene names, okay, that are involved in the tooth development. Okay, that's important. Then like the origin of enamel, like from which structure enamel is formed, or like from which structure dentine is formed, like that you should have a general idea in the development chapter. Then coming to enamel, dental pulp and cementum, all those structures in the tooth. In enamel, usually like perikymata or imbrication lines of pickerel, what are they? That can be asked. And related to dentine, pre-dentine, like where you can see argyrophilic fibers, where like what are like Wonkov fibers, such questions can be asked. Okay, dentine is like one of the favorite topic of examiners. Pulp, rarely asked, but if they are asking, then they can ask about the zones or the nerve supply. Okay, that's commonly asked. Now, regarding cementum, the types can be asked, the types of repair can be asked, like those are the usual questions from cementum. And the next topics like the bone, periodontal ligament, TMJ, and maxillary sinus. Regarding the bone, there was a question on rankle pathway. Okay, and which bone cell it is activating. Okay, so such deep questions from the bone can be asked, and from the PDL, fibers and the cells in the PDL can be asked, and TMJ, the articular disc, and what it is made up of, what type of cartilage, like that, all questions can be asked. And in the maxillary sinus also, rarely asked, like only I had seen while going through the previous year question papers, like only 1 or 2 questions, but they are related to the walls of the maxillary sinus and which openings are seen in which walls. Like that, you should have an idea about the maxillary sinus topics also. Then coming to oral mucosa, salivary glands, and eruption and shedding. Now, these four are like the favorite topics of examiners. Oral mucosa, definitely some questions related to like non-keratinocyte or keratinocyte or tonofibril or regarding the layers can be asked. Then the salivary glands, the major and minor salivary glands, and where they are present, the von Ebner's gland, the glands of Blandin and Nunn, and where they are present, and the major salivary gland duct openings where they are getting open to the specific position, like that all can be asked. Okay. Eruption and shedding, another favorite topic of examiners, the sequence and when. They can ask the chronology also, like when a particular teeth is getting erupted or when a particular teeth is getting shed. Okay, and which are the cells that helps in the resorption process of deciduous teeth. Okay, they can ask, definitely ask questions like that. Now this is like an outline about oral histology. Now coming to dental anatomy can be a little bit challenging for students because like lots of numericals are involved. Okay, so if dental anatomy, you don't have to remember the exact dimensions of the teeth like that, like which you study for like university examination all, but you should have a general idea about which teeth has the longest root or which tooth has the longest crown, like that you should have an idea about that. Okay, then the tooth numbering systems and all. And another important thing is like there will be like special characteristic feature, morphological feature present in particular teeth, like the palatoradicular groove. Okay, so where this palatoradicular groove is present, in which tooth, like that, the questions can be asked. And also, they can also ask questions like in which tooth the mesial cuspal slope will be longer than that of the distal cuspal slope. Okay, such questions can be also be asked. So for differentiating two teeth, you should know like which is the differentiating feature that is playing an important role to differentiate between the two teeth. Okay, so such questions can be asked from like dental anatomy and also the occlusal aspect. Okay, what is the shape of the occlusal surface of maxillary molars? Or like what is the groove pattern seen in second premolars? Okay, so such questions can also be asked regarding dental anatomy. Now, other than this, there are two tables that are really important and you must study in dental anatomy. That is the chronology tables. Okay, both the chronology tables, chronology of deciduous dentition and chronology of the permanent dentition. Okay, lots of questions have been asked from these two tables itself. Okay, like when the first evidence of calcification is happening, when is the enamel formation getting completed in the deciduous teeth, when is this teeth getting erupted, like that questions can be asked. And the permanent dentition also, what is the when is the first evidence of calcification, when is the enamel formation getting completed, eruption happening, like that questions can be asked. Okay, so if you like study these two table itself, you will get a general idea, okay, about the chronology. Okay, when the tooth is getting erupted, like that you will get a general idea. So these two tables are really important. Just have a look at them daily, okay, so that it will stay in your visual memory forever. Okay, now let's begin with the questions. So coming to the first question, when teeth are embedded in the jawbone, it is called as what? Okay, if you know the options, you can tell the options, or you can tell your answers in the comment box also. Okay, doctors. If you know the answers, then you can comment it in the chat box. Okay. So when teeth are embedded in the jawbone, it is called as what? Is it diphodont or thicodont or heterodont or all of these? Okay, so these questions come under the basics of dental anatomy. Okay, if you look at the initial chapters of the dental anatomy, that's where you can see such type of questions. Okay, so they are even asking from the basics of dental anatomy. Yes. Yes, Dr. Amrita. Yes, you are right. It is thicodont. Yes, Dr. Avila. Yes, you are right. Okay, so let's see what this thicodont is. So, based on the attachment of the teeth to the jawbone, the teeth can be classified into three types. There is something called as acrodont and pleurodont and thicodont. Okay, so based on how the tooth is attached to the bone, okay, based on that, the tooth has been classified into acrodont, pleurodont, and thicodont. Okay, so if you look at it, acrodont means it is something like a rootless teeth. Okay, there will be no socket present. Okay, in acrodont and pleurodont, there will be no socket present. The teeth will be something like the crown of the teeth is like placed in the bone. Okay, that's how it will be appearing. There will be no socket seen in acrodont and the pleurodont type of teeth. Okay, so this acrodont type of teeth is also called as rootless teeth, and it is attached to the top surface of the jawbone. If this is a jawbone, then the acrodont teeth will be like attached to here. Okay, just the crown of the teeth will be attached to here like that. And since it does not have a socket and like it is not like very strongly held by the bone, it is very weak in nature. Okay, so it can easily be shed or the teeth can be easily lost. Okay, so such type of teeth are usually seen in the fishes and in some of the reptiles also. So that is acrodont, or which is also called as rootless teeth. Okay, so they can ask the questions like this also, like which of the following is called as the rootless teeth. Okay, so remember it is acrodont. Then next there is something called as pleurodont. In pleurodont, that is also teeth without any socket, but here the tooth is attached on inner and upper side of the jawbone. Okay, so the area covered by the crown of the tooth is much larger when compared to the acrodont type. Okay, so the tooth in the pleurodont, the tooth is attached to the inner and the upper side of the jawbone like this. Okay, so it usually it has a larger surface area when compared to acrodont. So it is much more stronger than acrodont, but not as strong as thicodont. Okay, so such type of teeth are usually seen in like lizards or in amphibians. Okay, so that's about the pleurodont. Then you have the next category that is called as the thicodont. Okay, so this thicodont means then the jaw will have sockets. Okay, the jawbone will have sockets and the tooth will be placed in these tooth sockets. Okay, just like what you see in humans and mammals like apes and all. What you see there, that is called as the thicodont. Okay, so the root will be attached firmly in the socket of the jawbone, and this type of tooth attachment has the strongest attachment. Okay, it is the very strongest attachment. It mimics like a peg and socket attachment. Okay, so this is the example of the thicodont type of teeth. Okay, most commonly seen in humans and apes and gorillas and all. Okay, so now I think you got an idea about the different types of donts. Now there are other terms like diphodont, heterodont also mentioned in the question, which we'll be discussing in the next question. Okay, because this question is also related to the first one. An adult human being has a total of 32 permanent teeth, which are of four types. They are called as, what are they called as? Yes. Yes, Dr. Amrita, you are right. Yes, it is called as option C, heterodont. Okay, so the one that we looked was one type of like classification of the teeth. Now there is another classification of teeth based upon its form and the function of the dentition. Okay, so There it is classified into homodont or isodont type of dentition. Then we have the specialized homodont type of dentition and heterodont type of dentition. So homodont type of dentition means, so functionally and anatomically, all the teeth will look similar. Okay. So there will be no differentiation like the incisors, canines, premolars, molars. There will be no differentiation like that. All the teeth will look similar. Okay, some of the teeth in the posterior areas may be larger than the ones in the anterior, but basically all the teeth will look similar. Okay, so such type of teeth are called as homodont or isodont type of teeth and dentition. Okay, most commonly seen in fishes and in amphibians. Then there is something called a specialized homodont. Specialized homodont means it is similar to homodont dentition only. All the teeth will be similar, but one particular teeth will be different. Okay, like the fangs of the snakes. Okay, so the ones that are present in the anterior region alone, it will be like very sharp and pointed. Okay, so such a type of dentition is called as specialized homodont dentition. Other than this particular teeth, all the other teeth are like similar in appearance only. But this teeth, for its you can say for prey catching abilities or for its predator activities, it is usually sharp in structure. Okay, so such type of dentition is called as the specialized homodont dentition. Then next, at the last, we have the heterodont type of dentition. Heterodont type of dentition means the ones that we see in the humans and in the apes and all. There will be like 4 different types of teeth. Incisors will be there for cutting, and canines will be for tearing, and premolars and molars will be there for grinding. Okay, so these are the four, when these 4 types of teeth are present, or like different morphology and for different function, different teeth are present, it is called as the heterodont type of dentition. Okay. So in the options, there were other options like diphyodont present also. So what do you mean by this monophyodont or diphyodont or polyphyodont? So that this type of like dentition is based upon the succession. Okay, so based upon the succession, the dentition is divided into monophyodont, diphyodont, and polyphyodont. Monophyodont means only one set of teeth will be present for the entire lifetime. Okay, so for the entire lifetime, only one set of teeth will be present. If that is lost, then it's lost. That's it. No new teeth will be formed in its place. Okay, so such a type of dentition is called as monophyodont dentition. Mostly seen in some kind of like sharks and other animals. Okay. And then we have the diphyodont dentition, which is the human dentition, what we see in the human dentition. There will be 2 sets of dentition. The first one will be the deciduous teeth or the milk teeth or the lacteal teeth. After a particular age, those teeth will shed and the new ones will be replacing those old ones. Okay, so the new ones are called as the permanent dentition. Okay, so such 2 types of teeth, they are called as the diphyodont type of dentition, most commonly seen in the humans and in the apes and all. Okay, then at the last, we have the polyphyodont type of dentition. Polyphyodont type means the teeth are continuously replaced throughout the life. Okay, once lost, it will be immediately replaced by another tooth. Okay, the ones that are present in the reptiles and all. Yes, that is an example of the polyphyodont type of dentition. Okay, once lost, it will be immediately replaced. Okay, so this is the like the different types of dentition based upon the succession properties. Then we have like different types based upon the molar type also, like the lophodont, bunodont, selinodont, hypsodont, branchiodont, and all those terms are there. You don't have to like go in detail regarding it, because usually the questions asked from this area is comparatively less, but this lophodont was present in the options. Okay, that's why I included it. So this lophodont means the cusp will be fused into ridges like that. Okay, so that is the based upon the molar type only, the teeth are divided into these types. Okay, these 5 types. Okay, just have an idea about it. Humans usually have a bunodont type of dentition. Okay, the we have like separate rounded cusp will be present. Now, next question. The mucosa of the hard palate is. What is the mucosa of the hard palate? Is it keratinized and does it have submucosa and minor salivary glands? Or is it non-keratinized and it does not have submucosa and like minor salivary glands? Which one can be the answer? The mucosa of the hard palate is, yes, doctors. Okay. So the mucosa of the hard palate, mucosa means, yes, the epithelium, yeah, you can call it like the epithelium or the mucosa of the hard palate is usually hard palate and gingiva usually have the keratinized mucosa. Okay, it has the keratinized epithelium. Okay, and whether it has submucosa and minor salivary glands, we will have a look at it. So oral mucosa based upon its function. Okay, oral mucosa based upon its function. Yes, Dr. Denisha. Yes, so the oral mucosa based upon its function, it can be of three types. We have the masticatory mucosa, lining mucosa, and specialized mucosa. This masticatory type of mucosa is seen in the gingiva and hard palate. This masticatory mucosa will be usually keratinized. Okay, so the mucosa in the gingiva and hard palate are usually keratinized. Okay. Whereas the lining mucosa that is present in the lips, cheek, the vestibule, alveolar mucosa, and the floor of the mouth and soft palate, all the other parts except the gingiva, hard palate, and the tongue, all the other parts of the oral cavity will have lining mucosa, which will be usually non-keratinized. Okay. So the lining mucosa will be usually non-keratinized. And then we have the specialized mucosa. Specialized mucosa means the one that is present in the dorsum of the tongue because it has like papillae and taste buds. It is kind of like a specialized type of mucosa. Okay. So remember the like the keratinized mucosa will be present in the gingiva and hard palate. Now, if you look at it in the gingiva and in the anterior raphe of the hard palate and in the gingival areas, there will be no submucosa. Okay, the submucosa will be absent. Okay, submucosa is more like the area that is in the connective tissue that is like above the muscular layer. Okay, so this submucosa will be usually absent in cases of gingiva and in the anterior raphe of the hard palate, it will be absent. But here in the options, it is specifically mentioned whether this submucosa is present posterolaterally. Okay, posterolaterally means near this molar region. Okay, so in this near this molar region, yes, submucosa is present. Okay, and in the submucosa, along with that, you will be able to see the minor salivary glands also. Okay, so the right option in among these is that the mucosa of the hard palate is keratinized and it has submucosa and minor salivary glands posterolaterally. Okay. Here, the second option, it's non-keratinized. No, it doesn't have a non-keratinized epithelium. And here, the third option is keratinized and it lacks submucosa and minor salivary glands. Yes, it lacks only in the anterior or the middle portion of the raphe. Okay, only there it is absent. In the posterolateral side, it is present. Okay, again, non-keratinized, so it is ruled out. Okay, so among the options, the most suitable one is the first one, option A. So we are going with the option A. Okay, so hard palate, as you have seen, it is a keratinized stratified squamous epithelium, thick, maybe ortho or parakeratinized, and like vascularity will be like moderate vascularity, and submucosa is present in these posterolateral areas. Okay, and salivary glands will also be seen. The salivary glands are usually absent in gingiva and in the anterior raphe of the hard palate and in the anterior 2/3 of the dorsum of the tongue also. Okay. So now I think you got an idea about the different types of oral mucosa. Now moving on to the next question. Enamel formation of all deciduous teeth is usually completed by. Okay, so by what age the enamel formation of all deciduous teeth will get completed? Yes, this is an easy question. Yes. If you know the answer, you can put it in the chat box, doctors. Yes, it is usually completed by 12 months. Okay, here this is the, like in questions like this is where the importance of this table is there. Okay, so the chronology of the primary dentition. Okay, you should have a look at it. The chronology of the primary dentition, this table, and the chronology of the permanent dentition, both are really important. Okay, so the enamel formation or the first evidence of calcification usually happens around 14 weeks in utero. Okay, for the upper and lower central incisors. Okay, that's when the enamel formation actually starts taking place by 14 weeks in utero itself. Okay, then that enamel formation of all the deciduous teeth will get completed by around 11 months. Okay, when the child reaches around like 11 to 12 months of age, the enamel formation of all the deciduous teeth will get completed. Okay, and the last tooth to get like the to finish the crown completion will be usually the maxillary second molar. Okay, maxillary second molar will be the last teeth to finish the crown completion procedure. And the eruption usually starts by around 8th month. Okay. And the last primary teeth to erupt will be usually the maxillary second molar. Since it is the last one to get to finish the crown completion, definitely it will be the last one to erupt. Okay. So this is regarding the chronology of the primary dentition. Both the primary dentition and the permanent dentition both are important. So have a look at it. Okay. When the crown completion is happening, when is the first evidence of calcification? When is the eruption happening? All those you should definitely remember. The next question. The loop formed by the inner and outer enamel epithelium is called as. What is it called? Yes. An easy one. Right, doctors? Yes. It is the cervical loop. Okay. So during the cap stage, okay, yes, Dr. Denisha, yes, Dr. Abhinaya, you all are right. So during the cap stage or the early bell stage, if you look at the histopathology of the tooth development, this outer layer is the outer enamel epithelium and this is the inner enamel epithelium. Okay, so this outer enamel epithelium and this inner enamel epithelium will meet at a common point here. Okay, so that common point is called as the cervical loop. Now, this cervical loop will have only outer enamel epithelial cells and inner enamel epithelial cells. It will not have stratum intermedium or stellate reticulum or all other types of cells are seen in the cap and bell stage, right? So, such cells will not be seen at this particular area. Okay, so this particular area will have only the inner and outer enamel epithelial cells. Okay, so this outer enamel epithelial cells will be usually cuboidal in nature. Okay, like this cube shaped. Okay, it will be usually cuboidal in nature like this. Okay, so this is how the cell will appear. Whereas the inner enamel epithelial cells will be usually columnar in shape like this. Okay, very long and columnar in shape like this will be seen. Okay, so at this area, at this particular cervical loop area, this cuboidal cells, this small cuboidal cells will get converted to this long columnar cells. Okay, so that is that particular area where this short cuboidal cells will get converted to long columnar cells. Now, what is the importance of this cervical loop? Why this cervical loop is important? Because it is the area of highest mitotic activity. Highest mitotic activity means the cells will be continuously dividing at this area. Okay. Why they are continuously dividing? Because once the crown formation gets completed, okay, once the crown formation gets completed, then this cervical loop will start growing downwards. Okay, it will grow downwards and it will help in the formation of Hertwig's epithelial root sheath, which will form the root. Okay, which will form the root later. Okay, so that's why this area is important. Now, once the crown formation is all completed and it reaches the cervical loop area, then only the cervical loop will start growing downwards and it will help in the formation of Hertwig's epithelial root sheath, which will again contribute to the formation of root. Okay, so that's why this area is important, and this cervical loop only forms the future cemento-enamel junction. Okay, so that is the importance of this cervical loop. Yes, moving on to the next question. Which of the following genes defines the localization of the tooth germs? Okay, so like I had already mentioned, the genetics in tooth development is vast and a little bit complex, but you should have an idea about the general genes that contributes to the tooth development. Yes, Dr. Amrita. Yes. Yes, you are right. It is option A, PAX9 gene. Okay, so let's see what all genes contribute to the formation, contribute to in the determining of the tooth position. Okay, there are mainly 4 genes which help in the determination of the tooth position. That is, if these genes are expressed, not expressed, or if these genes are mutated and they produce like abnormal protein or something like that, then only like transposition and all those developmental abnormalities can happen. Okay, so the main 4 genes that are contributing to this tooth position determination is one is FGF8 gene. FGF means fibroblast growth factor gene. Okay, then you have the PTEX2. PTEX2 is the paired like homeodomain transcription factor 2 gene. Uh, you don't have to like study in depth regarding this, but at least remember the names. Okay, there is FGF8, there is PTEX2, then BMP4. BMP4 is the bone morphogenetic protein. Okay, and then at the last, PAX9. Okay, so out of these 4 genes, the first 3, okay, the first 3 are their proteins are expressed in the epithelia. Okay, whereas the last one, this PAX9 alone, its protein is expressed in the mesenchyme. Okay, that is in the connective tissue. Mesenchyme means the primitive connective tissue is called as the mesenchyme. Okay, so this PAX9 alone, its protein is expressed in the mesenchyme of the oral cavity. Okay, whereas the others, it is expressed in the epithelium. Okay, so these genes, they interact with each other. Okay, so they helps in, they gives like a positive feedback and they can give a negative feedback also. For example, if PTEX2 and FGF8 are there, then they usually have a positive mechanism. That is, this gene can positively influence this gene. Okay, so that is a positive mechanism. Then there is like BMP4 and BMP2 and all. Okay, so this BMP genes, they negatively influence this PAX9. Okay, whereas this FGF8, it positively influences this PAX9. When it positively influences only, it can lead to the correct localization of the tooth germs. Okay, if it is not like positively influencing, or if it is like negatively influencing, then the tooth localization process can be aberrant. Okay, so that's the main factor regarding the PAX9. So this FGF8, it will positively influence this PAX9, whereas this BMPs, they negatively influence this PAX9. Okay, so this expression of PAX9 gene is very important because the protein that is released by this gene will help in the exact localization of the tooth in the connective tissue. Okay. Now, in the options, there is something called as LH6 and LH7 also. This LH6 and 7 are nothing, but they are called as the homeobox gene. Okay, so these homeobox genes are very important in the development of the craniofacial structures. Okay, almost all the craniofacial structures are influenced by these homeobox genes. Okay, so remember the name, they are called as the homeobox genes and mainly includes LH6 and LH7. Okay. Now, next question. What does the term scap in an immature permanent tooth denote? Okay, what do you mean by scap? Does it mean like surgical closure of apical foramen, or is it a unique population of dental mesenchymal stem cells, or the retrograde apical sealing technique, or the apical barrier apexification procedure? Okay, so yes. Yes, doctors. So there is a confusion between option A and option B here. So in an immature permanent tooth, what does scap means? Okay, so scap is actually, it is a unique population of dental mesenchymal stem cells. Okay, I will explain to you in detail. So the stem cells, what are the stem cells? The stem cells are the immature cells. Okay, so they have the potential to differentiate into any specialized cell with a distinct function. Okay, the most immature cells are the stem cells. Okay, you can just activate them and they will get differentiated into any cell of the choice. Okay, they can get differentiated into like a amyloblast, which will form enamel, or odontoblast, or osteoblast, which will form bone, or cementoblast, which will form cementum. Like that, they can get activated into any type of cell. Okay, so in the oral cavity, there are like some special areas where these stem cells are present. Okay, so there are something called as the gingival mesenchymal stem cells. Okay, these are present in the gingiva and they are called as the gingival mesenchymal stem cells. Okay, then in the pulp, inside the pulp, we have lots of stem cells. Okay, they are called as the dental pulp stem cells. Okay, and in the exfoliated like deciduous teeth. Okay, in the exfoliated deciduous teeth also, inside the pulp of this exfoliated deciduous teeth, there will be lots of stem cells. They are called as the stem cells from the exfoliated teeth, which are also called as the shed. Okay, the stem cells from the human exfoliated deciduous teeth. Okay, that's why it's called as the shed. Okay, then in the dental follicle. Okay, so before the eruption of teeth will usually have a dental follicle covering it. Okay, so from this dental follicle also, we will get lots of stem cells. They are called as the dental follicle stem cells. Then there is the from the periodontal ligament. Okay, from the periodontal ligament that is surrounding the tooth, you can get lots of stem cells, which are called as the periodontal ligament stem cells. Then in a young permanent tooth, there is something called as like an apical papilla. Okay, apical papilla is more like an soft tissue that is present at this apex of the developing tooth. Okay, so if you look at this apical papilla also, this apical papilla will have like lots of stem cells. Okay, so such stem cells that are seen in this apical papilla is called as the scap. Okay, scap and shed are really important because they can ask like, what does this shed mean, or what does this scap mean? They can ask about it. Okay, so the scap is the stem cells that are from the apical papilla. Okay, so this is like overall overall information about all the stem cells that are present in the oral cavity. And as you can see, the scap is like isolated in 2006 only, and it is the primary source of the odontoblast also in the root region for the dentine formation. This scap is the primary source of odontoblast. And one good thing is that if we take these stem cells and we process it in the lab, and we give proper induction techniques. Okay, we use proper induction technique and we activate it. These stem cells can get converted to osteoblast. Okay, that is the bone forming cells. Okay, from just this one cell, it can form bone. Okay, and then it can also form like adipocytes, okay, or the fat cells. Then odontoblast can be formed from these cells, and the neural cells, okay, nerve regeneration and all can be done with the help of these cells, and also hepatocyte, okay, liver cells, okay. So it can contribute to the liver regeneration techniques also, okay, just from the cells that are isolated near the root of the tooth. Okay, from these cells, we can, with the proper induction techniques, it can result in the formation of the hepatocytes or the liver cells, and it can lead to liver regeneration procedures also. Okay, so that's an interesting uh, way for the stem cells. Now, moving on to the next question, the incisor tooth buds for the permanent dentition is to appear normally about the third month. On which aspect of the primary teeth it should appear and develop to avoid a possible developmental anomaly. Okay, so the tooth bud of the permanent dentition should be present at which aspect of the primary teeth? Okay, to avoid a possible developmental anomaly. Yes, Dr. Pooja. Yes, Dr. Amrita. Yes, you are right. Both are right. It should appear at the lingual aspect. Okay. Yes, Dr. Denisha. Yes, Dr. Abhinaya. All are right. It should appear at the lingual aspect. Okay. So if you look at the shedding process or the resorption process of the deciduous teeth, usually when this resorption happens, it happens when this permanent tooth bud, when it gives a pressure to the deciduous teeth, that's when the resorption process actually starts happening. Okay, so this pressure exerted by this growing and the erupting permanent teeth is responsible for, or it decides the pattern of resorption of the deciduous teeth. Okay, so if you look at the anterior teeth, okay, incisors and the canines, if you look at the anterior teeth, usually the permanent tooth bud will be seen at the lingual aspect. Okay, it will be seen at the lingual aspect of the teeth. Okay, and the resorption will first happen in the lingual aspect of the deciduous teeth. Okay, so that's the usual pattern that is seen in the uh, incisor region. Whereas if you look at it in the posterior region, okay, in the posterior region, usually the premolar tooth bud will be placed between the roots of the molars. Okay, it will be placed between the roots of the molars. So the resorption usually happens in this area. Okay, that is the inner surface of the roots only. The resorption first starts happening. Okay, so the resorption areas in the anterior region and the posterior region is a little bit different. That's why in the question it's like specifically mentioned in the incisor tooth bud. Okay, so in the incisor tooth bud, usually the resorption happens at the lingual surface. Whereas for the posterior teeth, it is the interradicular region. The bud will be seen at the interradicular region. So the resorption usually starts at the inner surface of the roots of the deciduous molars. Okay, after this lingual placement of this tooth bud, and after this lingual like root resorption start, then by around like if the 2/3 of the root is resorbed, then this tooth bud, it will move. Okay, it will move a little bit and it will come right under the deciduous teeth. Okay, so that is also a characteristic of this permanent tooth bud. After the resorption happens in the lingual aspect of the deciduous teeth, as the resorption goes on, this tooth bud also moves a little bit and will be placed right under the deciduous teeth. Okay, and once it is shed, this tooth will be erupting into the oral cavity. Okay, so that is about the eruption and the resorption process. Now, next question, the articular disc of TMJ is it fibrocartilage or hyaline cartilage or elastic tissue, or is it a TMJ ligament? What is the, uh, like the articular disc of TMJ is made up of what type of cartilage? Yes, doctors. Yes, Dr. Abhinaya. Yes, you are right. It is fibrocartilage. Yes, Dr. Danisha. It is made up of fibrocartilage. So TMJ? Yes, Dr. Amrita. Dr. Deepraj. Yes. Okay, so the TMJ, it has two types of components. It has hard tissue components and the soft tissue components. All the bony parts like the mandibular condyle and the glenoid fossa of the temporal bone and the articular eminence, that all comes under the hard tissue components. Then we have the soft tissue components also, like the articular capsule, articular disc, and the ligaments and muscles are all involved under the soft tissue components. Now, one of the important soft tissue component is this articular disc. Okay, so this articular disc is like an oval, firm, thick plate of fibrous cartilage. Okay, it is made up of fibrous cartilage and it is located between the condyle and the articulating surface of the temporal bone. Okay, it mainly acts like a shock absorber and stress distributor, and it also helps in the gliding movement of the mandible. Okay, it is very thick at the periphery and very thin at the center. Okay, mostly does not have any blood vessels also. Okay, so it is divided into like four parts also: anterior band, intermediate band, posterior band, and bilaminar zone is there. So in the anterior and the posterior band, there will be fibers. Okay, these fibers will be running in the anteroposterior directions. Whereas in the intermediate band, it will usually have like thin collagen fibers running anteroposteriorly. And there is a retrodiscal pad also. Okay, it is a disc that is attached to the capsule by this retrodiscal pad. Okay, then bilaminar zone is also there. Okay, so this is the retrodiscal pad and the bilaminar zone is also there. Okay, just understand that the articular disc is made up of fibrous cartilage. Now next, which of the following deciduous tooth does not resemble any of the tooth in permanent dentition? Okay, so according to the universal numbering system only, they had numbered the deciduous teeth here, or they had denoted the deciduous teeth here. So it is it A or B or J or L? So first you need to understand which teeth belongs to which category, and then yes, choose the correct answer. So which of the following deciduous teeth does not resemble any of the tooth in permanent dentition? Which can it be? Yes, it is option D, L. Okay, so let's see what they are referring to. When they denoted, it means the maxillary right second molar. Okay, deciduous maxillary right second molar. And B also is the deciduous maxillary right first molar. Okay, then next option C was J. J refers to the maxillary left second molar. Okay, and the last option was L. Okay, L refers to the mandibular left first molar. Okay, so out of the four options given, yes, Dr. Danisha. Yes, out of the four options given, the A, B, J are like the maxillary teeth, and only L is the mandibular teeth. Okay, so this mandibular first molars usually does not resemble any teeth in the oral cavity. Okay, so if you look at it, most of the deciduous teeth, they have a resemblance to the permanent dentition. Okay, the incisors and the canines, they have a resemblance to the permanent dentition. But this mandibular, deciduous mandibular first molars, they usually does not represent any teeth in the permanent dentition. It is mostly like a primitive structure of the teeth. Okay, it does not resemble any teeth. Okay, this second molars, okay, whether it is like maxillary second molars or mandibular second molars, they usually resemble the permanent molars. Okay, but these first molars, especially the mandibular first molars, are completely different. They do not resemble any other teeth. Okay, maxillary first molars, it is like an intermediate between the maxillary premolar and molar in structure, but still some resemblance to like maxillary premolars and molars will be there. But this mandibular molars are first molars are like they do not resemble any other teeth in the oral cavity. So if you look at the mandibular left first premolars, it usually has like two roots, the mesial and the distal root are all present. Then four cusp will be there, and sometimes like a very like rudimentary distal cusps may be present. Okay, the usual distobuccal cusp and the mesiolingual cusp, distolingual cusp and the mesiobuccal cusp and the mesiolingual cusp will be present. And sometimes just like a tubercle like distal cusp may be present or may not be present. Okay, so that is the morphology of this mandibular left first molar. Now, next question. Which of the following permanent tooth has a single antagonist in occlusion? Okay, single antagonist means when our teeth are in occlusion, usually almost all of the teeth. Yes, Dr. Amrita. Yes. Okay. So usually all of the teeth, it will be in contact with two other teeth. Okay. When our jaws are, when we are like occluding our teeth, almost all the teeth in our oral cavity will be contacting two other teeth in the opposing arch. But there are only like two teeth which has only a single antagonist. That is, it will contact only one teeth in the opposing arch. So, okay, so which are that teeth? Any idea? Yes, Dr. Renisha. I'll explain to you in detail. So, antagonist teeth means the tooth that opposes the another tooth in the opposite jaw in occlusion. So to make things clear, the cusp is not shown here. Just a flat occlusal surface is seen so that it will be more clear for you. Okay, so if you look at the maxillary central incisor and all, okay, it is in contact with the mandibular central incisor and the lateral incisor. Look at the maxillary lateral incisor. It is in contact with the mandibular lateral incisor and the mandibular canine also. But there are two teeth which only has a single antagonist. Okay, so one is this mandibular central incisor. Okay, mandibular central incisor has only one antagonist, that is the maxillary central incisor. And look at this maxillary third molar. Okay, so this maxillary third molar, it also has a single antagonist, that is the mandibular third molar. Okay, so only these two teeth has a single antagonist. And in the options, the central incisor is not given. Okay, so we are choosing the best option, that is the maxillary third molar. Okay, so maxillary third molar and the mandibular central incisor are the two teeth that has a single antagonist. Okay. Now, moving on to the next question. Which of the following tooth has mesial cusp slope longer than that of the distal cusp slope? Okay, so these are some of the like differentiating features that helps in differentiating us between the tooth. Okay, so like the if you want to differentiate between the maxillary first and second premolar, then this feature is mainly considered as an important clue. Okay, so which of these teeth has the mesial cusp slope which is longer than that of the distal cusp slope? Is it maxillary first premolar or mandibular canine or maxillary canine or maxillary second premolar? Yes. Okay, Dr. Pooja. Any others? Okay, so the answer is yes, Dr. Abhinaya. Yes, it is maxillary first premolar. Okay, so maxillary first premolar will always have its mesial cusp slope will be longer than that of the distal cusp slope. Okay, so these are all the tooth images from the buccal aspect. Okay, the maxillary canine, the mandibular canine, maxillary first premolar, and the maxillary second premolar. Okay, so usually the mesial slope of the maxillary premolar will be very much longer than that of the distal slope. Okay, look at the maxillary canine or the mandibular canine or the maxillary second premolar. Their mesial cusp slopes will be usually very short when compared to the distal cusp slope. Now, what do you mean by this cusp slope means? The cusp will form like a slanting slopes, which will meet at the cusp tip. Okay, so these slopes that are present in the canines and premolars, they are called as the cusp slope. Okay, so it's in the mesial side, it is called as a mesial cusp slope, and if it is in the distal side, it is called as the distal cusp slope. Okay, so the main differentiating feature of this maxillary first premolar from the other teeth is that the mesial cusp slope will be usually longer when compared to the distal cusp slope. Okay, so such a feature is not seen in maxillary second premolar or in the maxillary canines or in the mandibular canines or any other teeth. Okay, so remember this maxillary first premolar only has a long mesial cusp slope. Okay. Now, next question. The shape of the occlusal aspect of the maxillary permanent first molar is. What is the shape? Is it trapezoid, rectangle, square, or rhomboid? Yes. Okay. So the shape of the occlusal aspect of the maxillary permanent first molar is usually rhomboid in shape. Okay. Yes, Dr. Abhinaya, yes. It will be usually rhomboid in structure. The sides will be usually parallel to each other. Okay, in the maxillary molars, it will be usually parallel to each other. So if you look at the occlusal aspect of the maxillary first molar, you will be able to see like four cusps. There is the mesiobuccal cusp and the distrobuccal cusp and the distrolingual cusp and the mesiolingual cusp. Okay, then an extra cusp of Carabelli may be present in the palatal area. Okay. Now, other than that, there will be fossa also, like the central fossa and the distal triangular fossa and the mesial triangular fossa and all will be present also. And the ridges, okay, the cuspal ridge, the transverse ridge, the distal marginal ridge, and the ridges will be present. And grooves like the buccal groove and the distal oblique groove, central grooves will be present in this occlusal aspect of the maxillary first molar also. Okay. But if you look at the whole shape of the tooth, it will be usually rhomboidal. Okay, the sides are usually like parallel to each other. Okay, rhomboid shape is commonly seen in the occlusal aspect of the maxillary first molar. Now, next question. Which of the following is not a groove pattern of mandibular second premolar? Yes, doctor. Which is not a groove pattern? Yes, Dr. Amrita. Yes, it is option D, M. Okay. So this second premolar, the mandibular second premolar, it can have variations. Okay. Sometimes, usually only two cusps are seen, but sometimes there it shows a three cusp pattern. Okay. So in this three cusp pattern, there will be only one buccal cusp, and then there will be two lingual cusp. There will be a mesiolingual cusp, and there will be a distrolingual cusp. Okay. So when this three cusp pattern is seen, it usually produces a Y-shaped groove like this. Okay. So this is the Y-shaped groove pattern that is seen in three cusped second premolar. Okay. So this three cusp is actually a variation. Okay. It is not normally seen in second premolars. It is actually considered as a variation. When this three cusp pattern is seen, then you can see this Y type of uh, groove pattern can be seen. And here what is happening is that there will be a mesial developmental groove and a distal developmental groove and a lingual groove will be there. Okay, so all these grooves will meet at this central pit. Okay, so this is the usually what is seen in the Y pattern. Now, if you look at the U type and the H type pattern in the second premolar, there will be no central pit. Okay, there will be no central pit. And as you can see here, this is the U pattern. Okay, so this is the U pattern of the premolar and this is the H pattern. Okay, the central pit is absent here. Okay, there is no central pit and there is a central groove present, and this central groove, it goes from this distal pit to mesial pit. Okay, so that is what is seen in the U type. In H type, what happens is that these two grooves, this distobuccal groove and the mesiobuccal groove, it uh, goes towards the lingual surface also. Okay, it goes towards the lingual surface and form a distolingual groove and the mesiolingual groove. Okay, so that's how this H pattern is getting formed. So basically, in a second premolar, usually three groove patterns are seen. One is Y pattern, which is seen in the three cusp pattern, and the other ones are like the U type and the H type, which are usually seen in the with the two cusp. Okay, so this is about the second premolar. Now next, the cells concerned with resorption of the deciduous teeth are. Okay, so which cells help in the resorption of the deciduous teeth? Okay, teeth as a whole. Is it osteoblast or cementoclast or odontoclast or pericytes? Among the options given, option A, osteoblast, is bone forming cells. Okay, and option D, pericytes, are the cells that are seen like around the endothelial cells. Okay, so these are not resorbing cells. So both these options can be ruled out. Then the remaining options we have is the cementoclast and the odontoclast. Okay, among these two options, the cementoclast are the cells which help in the resorption of the cementa. Okay, only the cementa. Whereas this odontoclast, it helps in the resorption of the cementum, dentine, enamel, and the whole tooth. Okay, so since in the question it is asked like the cells concerned with the resorption of the deciduous teeth, that is the whole deciduous teeth, it is more appropriate to choose option C, odontoclast. Okay, so this is one way by which you can arrive at the answers, like eliminating the other options and choosing the correct option. Okay, so yes, Dr. Abhinay, the correct answer is option C, odontoclast. So let's see what this odontoclast are. These odontoclast are like the multinucleated giant cells. Okay, they are very similar in appearance to the osteoclast. And from where does this odontoclast come? They come from the circulating monocytes. Okay, and not just any monocytes, but trap positive monocytes. Okay, trap means tartrate resistant acid phosphate phosphatase releasing monocytes. Okay, that's a special type of monocytes. So from this trap positive circulating monocytes only, these odontoblasts are there. Okay, and during the tooth resorption time, what this odontoclast they do is that they will get attached to the root surface. Okay, they will get attached to the root surface. So if you look at the structure of this odontoclast, it has a smooth surface like this, and it has a ruffled border like this. Okay, so at one end, it has a smooth surface, and at the other end, it has the ruffled surface. This ruffled border is only what is getting attached to the tooth surface. Okay, so this ruffled border is what is going and attaching to the tooth surface for resorption. Okay, so once it gets attached, it will form a sealing zone. Okay, so at the ends of this odontoclast, you will be able to see these structures. Yes, those are the sealing zones. Okay, once it get attached, it will just seal. These sealing zones will get activated and it will just seal. Okay, and like lots of organelles like the mitochondria and the lots of like endoplasmic reticulum, they all go to this ruffled border state end. Okay, and just above this ruffled border there is something called as a clear zone. Okay, so this clear zone will be like usually devoid of any organelle. Okay, it will not have any organelle. Okay, so what it does is that when this odontoclast, when it goes and get attached to the tooth or the root surface, this ruffled border of this odontoclast, it will release lots of H plus ions. Okay, it will release lots of H plus ions and it will create an acidic environment. Okay, so this acid will be able to like demineralize the hard tissues of the tooth. Okay, so that's the mechanism action of this odontoclast. They will get bind to the root, they will release lots of H plus ion, creates an acidic environment, and which helps in the demineralization of the hard tissues of the tooth. Now, next question. Epithelial rust of molasses is seen in. Okay. Is it seen in palate or gingiva or periodontal ligament or dental pulp? So, epithelial rust of molasses or cell rust of molasses are the remnants of Hertwig's epithelial root sheath. Okay, Hertwig's epithelial root sheath is what helps in the formation of the root. Okay, so once the root is formed, this Hertwig's epithelial root sheath, it gets like disintegrated and it will be present in the connective tissue as or in that particular structure as lots of cell rust. Okay, so such cell rust are called as the cell rust of molasses. So where is it usually seen? Yes, Dr. Abhinaya. Yes, Dr. Denisha. It will be usually seen in the periodontal ligament. Okay, so the cells of the periodontal ligament, it can have cells like the fibroblast. Yes, yes, Dr. Amrita, you are right. It is the periodontal ligament from where you can see this epithelial cell rust of molasses. Okay, so the fibroblast and the formative cells like the osteoblast, cementoblast, and the resorbing cells like the osteoclast, cementoclast, stem cells, and defense cells are all seen in this periodontal ligament. Now, along with these cells, you can also be able to see this epithelial cell rust of molasses. Okay, since these are the Hertwig's epithelial root sheath cells, after the root completion, it will be easier for them to go and like reside in the periodontal ligament. Okay, and it is usually seen scattered throughout the periodontal ligament. And in the periodontal ligament, you'll be able to see as clumps. Okay, so it will be like clumps of cells will be seen, which is like closely packed also with a very prominent nucleus and very scanty cytoplasm. And as the age increases, the number of these epithelial cell rust of molasses, they usually come down in number. Okay, so this is about the epithelial cell rust of molasses. Now, next question. The mesiolingual groove is seen in which of the following teeth? Okay, the mesiolingual groove. Such distinguishing like features that are present in some of the teeth, like the palatoradicular groove or the mesial marginal developmental groove or the mesiolingual groove, like where you will all see these structures, you should have an idea. So this mesiolingual groove is seen in which of the following teeth? Yes. Yes, Dr. Amrita. You'll be seeing it in mandibular first premolar. Okay, so if you look at the lingual aspect of this mandibular first premolar, there will be a small line of demarcation. Okay, so this small line of demarcation that is between the mesiobuccal lobe and the lingual lobe, that is called as this mesiolingual developmental groove. Yes. So if you look at the occlusal aspect of this mandibular first premolar also, you'll be able to see this mesiolingual developmental groove very prominently. Okay. It usually extends into the mesial fossa. And there are other grooves also present, like the mesiobuccal triangular groove and the distrobuccal triangular groove, and the central groove will also be present. But this groove will be very prominent if you look at the lingual aspect and the occlusal aspect of the mandibular first premolar. Now, mesiolingual groove is present in this, mesiolingual developmental groove is present in this mandibular first premolar. Now, in the maxillary first premolar, there is another groove that is present called as the mesial marginal groove. Okay. So do not get confused between the two grooves in the two premolars. Mesial marginal groove is present in the first premolar, whereas the mesiolingual groove is present in the mandibular first premolar. Okay, in the maxillary first premolar, you will have the mesial marginal groove, and in the mandibular first premolar, you will have the mesiolingual developmental groove. Okay, please do not get confused between the two. Okay, and then there is something called as the palatoradicular groove also. Okay, so this palatoradicular groove that is usually seen in the maxillary lateral incisors. Okay, so these three grooves are really important. Palatoradicular groove, which extends from the like the palatal aspect of the lateral incisor towards the root, it can extend. Okay, so that is called as this palatoradicular groove, which is usually seen in the lateral incisor. Then there is the mesial marginal groove, which is usually seen in the maxillary first premolar, and the mesiolingual developmental groove that is seen in the mandibular first premolar. Okay. Yes. So that's all for today. So if you have any doubts, you can ask now. Both these dental anatomy and oral histology are like scoring subjects, and uh, like you can really score good marks and full marks from these topics, because sometimes the clinical subjects can be tougher. Okay, they can ask you tough questions, but these basic subjects, it will be easy to answer, and mostly it will be factual, like memory based questions only will be asked. Okay, so once you understand the concept and once you understand the facts, then it will be very easy for you to answer this dental anatomy and oral histology questions. Okay. So try to score full marks in this DH, so that that will make a good improvement in your rank also. Okay. So yes, keep learning for your PSC exams, and we are currently doing keep doing revision also side by side. Okay, keep learning the new topics and keep doing revision also side by side. uh, the MPPSC exams, we are expecting it's the in the October, and for the Kerala PSC exams, we are mostly expecting it on the November month. So you have time for revision also. So do well, keep learning and keep revising. All the best for your preparations. Do well. And if you have any doubt, you can comment under this video, or you can ask me in the group also. Okay, in the WhatsApp group. Okay. So that's all for today. All the best. Good night and goodbye.